Good morning, everyone present here. A very warm welcome to all the attendees joining us today. I'm Shazia Shabir, and I'll be your moderator for today's session, organized by Neuroptech. Thank you all for taking out time on a Sunday morning to be here. Today's topic is both clinically relevant and intellectually fascinating, exploring the causes and risk factors of cerebral visual impairment, or CVI. This session promises to deepen our understanding of how brain related visual disorders are approached in modern optometry practices. Neuroptech is a platform that aims to bring together optometry professionals, students, and enthusiasts through educational sessions focusing on neurooptometry, vision science, and related clinical aspects. Through such webinars, Neuroptech continues to promote learning and discussion that bridges academics with real world clinical experience. It is my pleasure to introduce our speaker for today, Mr. Mohamed Danish. He's a consultant optometrist in the CVI department at Narayana Netralaya Eye Hospital. He holds a bachelor's degree in optometry and a fellowship in pediatric optometry, orthoptics, as well as in CVI. Mr. Danish has extensive experience in managing children with cerebral visual impairment and has been actively contributing to the field through his clinical work and research based learning. His approach combines both practical and scientific perspective, making him an excellent guide for today's topic. Thank you, sir, for joining us today. We're really looking forward to learning from your experience. Now, without taking any more time, let's hand it over to Mr. Danish to begin today's talk on cerebral visual impairment causes and risk factors. Sir, the stage is all yours.
So, good morning, one and all. So, first of all, I will thank you to Mr. Adnan for approaching me to take a class on neurooptometry, that too regarding to CVI. So, just give me a minute. I will start the presentation. So, is it visible my screen?
Yes, it's visible.
Okay. So, how many of us know what is CVI? The problem which is getting worse in day to day life in babies. Okay, so today we are going to discuss about exploring the causes and risk factors in CVI. So before going to CVI, I would like to take a basic class like what is CVI and how will you differentiate between OVI and CVI. OVI is nothing but ocular visual impairment and cortical visual impairment. So vision loss can originate from different parts of the visual system, like not only by our cornea or iris or any anterior chamber
Your
defect or
PPT is
posterior
not
chamber.
visible.
Sorry?
Excuse me, sir. Your PPT is not visible. It's just a black screen.
Okay, just a minute.
Okay.
I think. Now,
Yes, sir, now
Yes,
visible.
it's
is it
visible.
visible, Mr. Adnan?
It's visible.
Okay. So, let us go from the introduction part. So, vision loss can originate from different parts of the visual system. We all know not only the vision loss starts from the anterior or posterior chamber, it can also start from the visual pathway and other components of the brain as well as. So, how we will differentiate? Like Today we are going to discuss about what is cortical blindness and ocular blindness. So cortical blindness, in a simple term, I would like to tell like it is a brain related thing, but ocular blindness is completely oriented to eye related. So we need to learn more about visual pathway and the brain anatomy. So here you can see the eye is there, optic nerve, optic chiasma, then it passes to the optic tract, then lateral geniculate body, and to the optic radiations to the visual cortex. So, what is ocular visual impairment? It is a term specifically used to describe vision loss caused by the issues within the eye itself, such as damage to the retina, optic nerve, or other structures involved in the visual pathway. So, what will be the symptoms of ocular visual impairment? It will be like blurred vision. Patient might come to your clinic saying that he or she can't see the distance vision or near vision properly. Like they might be having a problem like myopia, hyperopia. Okay. So, next is light sensitivity. So, this comes under the category of contrast. Okay. So, next is eye pain and difficulty in focusing objects and visual distortion and sudden loss of central or peripheral vision. So these are all things which we see in our day-to-day practice, where as a general optometrist we are working in our clinic, we will get to know. So if the patient is complaining like I can't see for near, so we will be giving ad correction and all. Okay, but before going to the CVI, I want to tell you this particular part to differentiate. Okay, so you people are doing this day to day. So, causes of ocular visual impairment. So, mainly it will be due to the eye injuries, infections, cataract, and other ocular diseases. So, let us come to the main topic. What is CVI? So, CVI is nothing but cortical blindness happens due to the brain damage which make processing the signal sent from the eyes difficult. More specifically, it refers to the damage in the primary visual cortex. It can result in partial or complete vision loss. So, being cortically blind is often commonly labeled as cerebral visual impairment. See, there might be a confusion. What is cerebral visual impairment and cortical visual impairment? So, the visual impairment, which is not only affecting the cortical areas but also the other parts of the brain. If, for example, if any accidental injury happens, so the patient got um, injury at the frontal region, that might also lead to the cerebral visual impairment. Okay, so it is a neurological disorder caused by damage to the visual centers of the brain, which interferes with communication between the brain and eyes. So this line clearly indicates that the visual pathway, which is the processor of our brain to eye, if it's get affected, the child may get CVI. It, so cortical visual impairment only affects children, not only other age groups, like it can even occur in adults as well as. Okay, so in short term, the eyes are able to see but the brain cannot understand what they see. So in CVI kids, the way the child seeing the world will be completely different. So if you go to the many research papers which is being published in PubMed or ResearchGate, they might have done a mapping where the visual fields of the child as well as a normal child, they would have differentiated. So what is the brain involvement in vision? So can you see this picture? A child is trying to catch a red ball by jumping, but for us it's look like a picture. But what does the brain do? The child sees the ball, the frontal lobe. So before going to CVI, we should understand what is the anatomy of the brain. Like brain has total five lobes, like we know frontal lobe, parietal lobe, temporal, and occipital. Okay. So in the frontal lobe, the main primary action of the frontal lobe is to action of catching the ball and its strategy. Okay. The occipital lobe processes the information received through the eyes. It passes the processed image to the posterior parietal lobe via the superior longitudinal faculae. See, these terms will be little bit difficult, so I'm not going to take uh, anatomy of brain, but I given an example like how the brain is functioning to the vision, like whatever it sees, it interprets. Okay. So next is the middle part of the temporal lobe supports this process with the posterior thalamus and superior colliculi facilitating visual search, visual guidance for the movement. So visual search is nothing but if you set a target. So our eye is looking at the target. It's called as visual search. And visual guidance is nothing but the whole body which is making the eyes to turn to look at the object is called as visual guidance. So the ball is identified and chosen as the target. The parietal lobe gauges the distance between the child's hand and the ball. So parietal lobe's function is nothing but to assess the depth perception. Okay. So it mainly works on the spatial visual spatial localization. Okay. If this is not the child first time catching the ball, the temporal lobe takes part in the process as its control memory. It subconsciously reminds the child that their hands are used to catch a ball, that they need to reach out, and that their body needs to adjust. I hope everyone is understanding this picture. If anybody has any doubts, you can ask me. Okay. So the cerebellum helps the child adjusting the timing of their actions and their balance. Okay, the temporal lobes process local and detailed visual feedback via a bundle of nerve fibers on each sides. So in brain, we can see there are total two pathways, which is the main pathway to identify a picture or to interpret a picture, where it is located and what is it. For example, let us take examples now, like we are sitting in a computer or a mobile. So in front of that, how we know that this is a mobile or a computer or an object. So there are two pathways, which is called where and how pathway, or else what pathway. So the orange line indicates that what pathway. So this what pathway travels from the occipital lobe to parietal lobe, so which is called as parieto-occipital lobe pathway as well as. Okay. So in ventral pathway, you can see the purple arrow indicating like going from occipital to temporal as well as cerebellum kind of thing. Okay. So where pathway indicates the
Sir,
spatial.
you are not audible clearly.
One second, give me 1 second. I will check my internet. Am I clear?
Yes, sir, you're clear.
Okay. So here in ventral pathway, we can see the brain can interpret what color is it, what is the thing which is kept in front of us, and we will be knowing the name, like already which is being seen by our eye, and it is being processed already. So it can interpret the information like this is the particular thing. Like for example, this is an orange pen, this is a black pen, like that. Okay. But dorsal pathway is nothing but if I'm keeping something in a place where I know exactly that is where the place, like it is in this much distance. I need to go to pick up that object. Okay, see, so these two pathways is very much important in CVI kids. So in CVI kids, most probably these two pathways will be affected. Due to that, the child cannot identify the faces, which is called as prosopagnosia, and the child cannot able to climb stairs, or the child cannot bring something. Like if you command to bring a water bottle or a ball or a basket, the child will not able to bring because their pathway in their brain is being affected, so they cannot identify. So that same thing, if you give a child to do something like an activity, if the child is affected with dorsal pathway, the child will not be able to do. Why? Because the where pathway is not at all working. So what will be the common causes and risk factors in CVI? So before going to the causes and risk factors, we need to know the stages of delivery, like prenatal, that is called as before birth, and perinatal, during the time of birth, and postnatal, after the child is being born. So we need to know the normal gestation of the baby to identify whether the baby is premature or not. So when the patient is coming from a rural or urban area, the parent might not have that much educated. They don't know even what is premature baby. They will say in their own terms, like the water is being broken while I was delivering a child before the date of delivery. So that and all, we need to take a proper history in CVI. Because each and every history is important when we are assessing a kid with CVI. So what will be the risk factors? So you can see a tabular column like prenatal. So any maternal infection, that is called as TORCH, like toxoplasmosis, rubella, CMV, and herpes. If the mother is taking any drugs like paracetamol or any toxic drugs, it might be lead to CVI. So next is placental insufficiency or poor oxygen flow. So if the child is in the baby in the mother's womb, during that time, if the child is not receiving proper nutrition or poor oxygen, the child will lead to CVI. Okay. So next is genetic and metabolic disorders. So this genetic and metabolic disorders is nothing but if the parents are doing consanguineous marriage where the genes are getting modified, the child can develop Down syndrome or any other Usher syndrome, which can lead to the child to CVI. So Down syndromes is nothing but you might have seen in Sitare Zamin Par movie. Have you people watched Sitare Zamin Par movie? That movie clearly indicates the Down syndrome as well as autism as well as ADHD. ADHD is nothing but attention deficit hyperactive deficit. Okay, so please look at that movie. You will understand a little bit of what the child's perception will be in this world. Okay, so next is perinatal. During the time of birth, premature birth or low birth weight. So, or if a baby is born earlier, so the baby has to come naturally at the proper time to the world. If they are not coming, the baby is getting disturbed, so automatically there will be low birth weight. If there is low birth weight, the brain is not getting proper nutrients. So if the brain is not getting proper nutrients, the brain, inside the brain, the ventricles, the white matter, the gray matter, everything is getting damaged. So birth asphyxia. So birth asphyxia is nothing but the baby has a respiratory problem at the time of birth, so no proper oxygen level. How many of them see the child when born in our family? How we will go to the operation theater, sitting outside, and we will be asking the doctor or whoever the treating person whether my child is good, everything is good? No. So how they, the doctor itself calculate the baby score. There is a score, like they will rate it out, that is called Apgar score. Okay, so this Apgar score is basically on appearance, pulse, grimace, activity, and respiration. So that will be out of 10. So if the baby is passing around 7, the baby is a normal, so it's a good baby. So if it is coming more than 8, absolutely excellent. So if it is coming below 7, the baby has a problem, like the baby will be kept in NICU. So not NICU is nothing but neonatal intensive care unit, where the baby is treated very intensively with the help of oxygens, and a kangaroo care technique is being given. Okay, so next is hypoxic ischemic injury. So this is also related to respiratory. Okay. So intracranial hemorrhage. So what will happen is intracranial hemorrhage when the time of delivery, like the delivery is being done like cesarean as well as natural delivery or a forceps delivery. During that time, by using the forceps and all, the brain, so the baby will be coming out first by the head, not from the leg side. So head side, when it is not coming, they used to use the forceps and to pull out the baby outside. So during that time, any obstruction occurred into the baby's head, it can lead to the CVI. So next is neonatal seizures or infections. So neonatal seizures, we can tell if the baby after came to this world at the first 2 or 3 weeks, the baby is getting fever, or today's world, the nurse who is in the intensive care unit, suppose the baby might have fall down or they might have not done anything properly. So the chances of the baby to get seizures are more. So if seizures came, the baby's automatically the brain functioning as well as the signals which is being passes through the body is getting affected. So next is infections like meningitis and encephalitis. So this is occurring due to the any uh, infections occur during the pregnancy, like sepsis or anything. The brain might get affected by due to the cerebrospinal fluid. And next it comes to the postnatal, which is being after birth. Head injury or trauma, as I said, it is like a forceps or any injury happen while the mode of delivery. So next is brain infections. So next is hydrocephalus. So hydrocephalus, you can see some babies brought to your clinic or any hospital, that the baby's head will be very much big when you compare to a normal child. So they might have done like VP shunt surgery and all. Okay. So what happens in hydrocephalus? So hydrocephalus, the baby will have a big head due to the enlargement of the ventricles. So when the baby is getting older, like when the baby is getting developed, the baby will have surely developmental milestones delayed, like sitting, crawling, or walking, or standing, or speech delay. Everything will be delayed. So not only that, the baby will also have in problem with memory and thinking. Why? Because the enlargement of ventricles, that too in the ventral and dorsal stream, it will be difficult for the baby to think. And the baby will also have poor balance, means the baby cannot walk properly, as and the neck holding will be very difficult due to the enlargement of the head. Okay, so next will be one more thing, like hypoglycemic. Okay, so hypoglycemia is nothing but low blood sugar at the time of birth. So if there is low blood sugar, the baby will get automatically seizures. So to avoid that, proper breastfeeding needs to be done. So if a baby is coming, we should ask the mother whether you are feeding properly or not. Some mothers, they won't feed properly. They will leave the baby for 3 hours, 4 hours, or one day even. So I have a patient which has been not been breastfeeded properly. Later, the baby developed into hypoglycemic stage, and even the baby did not have fixing and following of life light at the initial stages. So we have done many vision therapy and stimulation exercises to get back the fixing and following of light in the baby. Okay, so next is prolonged seizures and epilepsy. So this might be due to, there will be a sudden history, like they will be coming to your clinic, they will say in 6 months my baby got a fever, after that my baby got so much ill. After that the baby is not responding. The baby was very much good enough before, at the time of delivery everything was normal, like the baby was fixing, following light, even the Apgar score was normal, everything was normal. But due to that fever which is not being treated properly, it may lead to seizures and the baby will develop the term CVI. Okay, so any doubts in this? Okay, so next is diagnosis and testing. So what are all the tests we can do when we suspect a child with CVI? So when it comes to the ocular visual impairment, we will be taking a medical history and observation. That means we will be taking a proper history taking, like comprehensively. Like we will be starting from the gender, accompanied by presenting complaints and chief complaints, what are the drugs they are been using. And we will take pediatric history taking, like drawing the pedigree chart, as well as the birth history, whether the child is full term normal delivery or cesarean delivery, and birth weight, did the baby cried after birth or not. And we will be asking the parents, like did the baby stayed in NICU for how many days and for what the purpose is, as well as then we will ask the parent whether you are married in consanguineous. If it is so, we need to do the genetic testings as well as so. Next is eye examination. In ocular visual impairment, we all know whatever things which is being done for a pediatric vision assessment, that we will do. Like we will check for if the baby is below 6 months, like CSM or teller acuity cards or Cardiff acuity cards. So with the help of that, we will be assessing their eye, and we will be giving the proper specs if it's required. And next is visual field test. So next is OCT and specialized tests like ERG if there is any pathological causes for ocular visual impairment. So next is cortical visual impairment. We will be taking a brief history. Like in this cortical visual impairment, the history is very much important. So when it comes to the age, every day and every month is important. Like when you take the history for a cortical visual impairment, like the child should be written as in this format, like 9 years and 2 months or 3 years and 6 months, exactly the months as well as why, because we need to know the milestones of the baby. So it is best to write the months as well as the days, even if it is available. Okay, so next is eye examination. So everybody will be having the question, how will you examine a child eyes who is diagnosed as CVI? That I will tell you in next slide. So next is brain imaging, MRI, CT, or pediatric neuro opinion. So in this one, if a child is suspected CVI, it's better to take always a MRI as well as an EEG if there is a history of seizures. So why? Because if the child is getting seizures due to the light, we need to interpret with EEG, and we also need to know from which part of the brain the seizures are provoking. So that is what important in doing EEG. So you can see a picture of electroencephalogram, which is called as EEG, where the brain waves are interpreted from all the lobes of the brain. So whether the seizures are coming from the frontal lobe, temporal lobe, or parietal lobe, or occipital lobe. Okay, so next is pediatric neuro. So after, we can't suggest the patient to take MRI, but pediatric neurologist can do. we can refer to a pediatric neurologist. So they will interpret and they will be diagnosing the kid as CVI. We as an optometrist, we can't diagnose CVI. Okay. So what is this functional vision assessment? So functional vision assessment is nothing but we are checking how the child using his vision in day-to-day life, like whether the child can do fine motor skills as well as gross motor skills, whether the child can able to think and interpret a picture, or whether the child can locate an object or a thing. Okay. So next is specialized test. Specialized test is nothing but what are the things which we use to assess a CVI kid. So you can see here a pediatric ophthalmologist is using a pediatric OCT, so which has been a handy thing to evaluate the biomarkers in CVI. So they will be evaluating the biomarkers in CVI. So you can look to the paper which has been published by our Dr. Anand Vinekar, head of the pediatric neurologist in Narayana Netralia in internet. Okay. So when to refer a child suspected CVI, and what will be the complaints of the parents? So I would like to tell, as an optometrist, we are all practicing in opticals or a hospital or a private setup. So if you find out these 10 characteristics in a baby or a children or even a teenage, you can refer this child to a pediatric neurologist or a behavioral optometrist. So first thing, color. So this is the first characteristics of CVI, which is preference of colors over the others can be used to highlight visual objects as or visuals. So the thing is, their child will be very much interested into one color, like particularly mainly they will be red, yellow, or green. So the child will be keep on looking at that color alone. They will not look the other colors as well as. Okay. So next is field preference. The child may ignore the visual information in a certain field or a favor a field to gain visual information. You can see. So how we will be doing visual fields like superior, inferior, temporal, nasal fields and all, right? Same how we will do for HFA. But here, if you bring a visual target to the child in front of the child, like a ball, for example, if you are bringing towards his eye, the child may not look by the lateral side, but if you present the ball in the up gaze, the child will catch the ball. Why? Because there is a field restriction, as well as due to that the child cannot see in the lateral gaze. Okay, so the child will have the field preference. So next is movement. The need for the object to move to attain visual attention. It can include shiny or reflective surface. The child with CVI will be most probably attracted to the glittering surfaces like reflection of light. If you see, if you take the child to the mall or anywhere, the child will be looking at the lights moreover. If there is any moving light or a very much reflection is coming from the light, the child will be looking at that. Okay. So next is visual reflex. May have an atypical responses to blink reflex and visual threat response that help to protect the eyes from harm. Naturally, if I bring any object or a thing near my eyes, our eyes will automatically protect, like our eyelids used to protect. That is called as menace reflex. Okay. So that menace reflex, here they have mentioned blink reflex and visual threat response. Blink reflex is different and visual threat reflex is different. Okay. So when it comes to the blink reflex, if you keep the hand or a finger in between the nose, the child will close the eye. But if the child is not closing the eye, that is the indication of CVI. Okay. Next is visual threat reflex. Like simply I am poking or popping up in front of his eyes, like with the help of ball, just like how we used to do to threaten a child, like this, just bringing the ball in front of them, or keeping our hands in front of their eyes, just like a thing. Okay, so if that doesn't, there is no closure of eyelids, that also indicates a characteristics of CVI. Okay, so next is light. May spend longer periods of time gazing at light or need light to get attention on a task. So if you notice, when you are looking for fixing and following of light, you might get false interpretation on this. The thing is, when the child will be having a complaint of poor eye contact as well as, but when we bring a flashing light in front of the child will suddenly look at that light wherever you take it, like in all cases. Okay, so visual novelty is nothing but in a simple term I will say, already the thing which is being liked by the child will look at that thing only alone. They will not respond to the newer thing. For example, if you give them a red and yellow ball, the child will pick red color ball alone. Why? Because already the child is having a preference of color, as I said in the first point, and due to the visual novelty, the child will pick up the red color ball alone. They will neglect the yellow color ball. So next is visual latency, the amount of time an individual needs to visually respond. The total time needed may depend on the child, their overall health, the learning environment, and the task at the hand. So, if I bring a target, for example, as I said earlier, a red and yellow ball, as soon as I present in front of the child, how much time the child requires to pick up the ball. So, in that part, all the processing things are happening inside the child's brain. So if it is taking longer time than an average child, so sure the child is having a visual latency to pick up the ball. Okay. So complexity. So it contains four aspects that may affect how a student visually attends. These include patterns, visual array, sensory environment, and human faces. So complexity, if you see, the thing is, if you present in such a way, like I said, two balls, if I keep some five or six balls, out of these six balls, if I tell the child to pick up one ball, the child will not pick up. Why? Because the child is having a dorsal stream defect, as well as where the wear pathway is not at all working, so the child cannot identify where is the red ball. And if the child's ventral stream is also affected, the child will not appreciate which is the red color ball. Okay, so giving more or two or three will get to know whether the child has a difficulty in visual complexity. Okay, so distance viewing may be difficult, as the further away an object is from the individual, the more information the individual is seeing. Distance viewing is something like the child cannot look at far so much. Like if a parent is calling a child from a 6 meters away, which is a normal vision for us, but the child will not respond, the complaint will be from the parents, like my child is not responding from for my actions when I am sitting at this much distance. For example, I am sitting in a sofa and the parent mother is bringing the child towards the room, but when the father is calling the child, but the child is not giving the proper eye contact as well as not looking at him, so this is called as distance viewing. So next is visually guided reach. May have difficulty looking while reaching for objects. They may look away, then reach. Reach, look away when making tactile contact. Feel or explore tactilely first and then look. So what is this called as tactile clues? Tactile clues is nothing but whatever which we use give stimulation from our hands. Like if, just for example, all of you just close your eyes, and whatever you are holding the thing, you will know, like this is a pen or a pencil. You just take any object in your home by closing your eyes. Think as if you are a blind and you are holding the object. So your brain can interpret the object. Got it? So that is called as tactile clues. The clues which is being going from our hands to brain directly. There are so many pathways connecting to the brain. Okay, so that is called as visual tactile clues. Okay, so this visual guided reach is nothing but if we bring the ball in front of the child may look at the first time, but then he or she may lost interest to look at the ball, and then again they will refix. So that is called as visually guided reach. But with that visually guided reach, they will use some clues, like they will touch the ball, then they will look. Okay, like with the help of the tactile clues they will look the ball. I hope so everyone is understanding this 10 characteristics of CVI. Okay, so this was the main important thing where we can suspect a CVI child. Okay, so what are the tools we used in assessing the functional vision assessment? So these are the major tools which is being used all over the world as well as in India to assess a kid with functional vision assessment test. Okay, to assess a kid as well as in CVI. So the first one is Leah paddle. So the second one is Leah symbols. Third one is contrast evaluating charts and a single optotype chart. So the fourth one, which is having a circle, square, house, apple. So that is called as Leah puzzle. So these all tests has been invented by our ma'am Leah Hyraven, who is the inventor of all these assessment tools for CVI and for functional vision assessment. Okay, so the next one is hiding ID, which is being used to assess the contrast sensitivity in the child who is having diagnosed as CVI. So next is mailbox. So the mailbox we use to assess the visual specialized localization, whether the child has the problem in dorsal way or ventral stream. Okay. So the next one is Leah rectangle. So that is one we use for to assess the size, whether the child can pick up the exact proper size of that particular target. So next question will be like Leah 1. So in a child, in a pediatric cases who is being suspected with CVI, how will you be detecting visual fields? So that will be the question. So with the help of the Leah 1, we will be grossly identifying the visual fields, not qualitatively. We will be identifying grossly. So next one is we will be using Leah emotions, whether the child, because the CVI kids have a difficulty in prosopagnosia, they will definitely have difficulty in identify faces as well as reaction to the emotions. Okay, so here you can see this Leah emotions cards where the baby is there smiling, laughing, crying. So we will interpret whether the which thing the child is having difficult. So next one is Cardiff acuity cards and Teller acuity cards. We will be measuring the child's visual acuity according to the grading plate. Like it is a quantitative test, not a qualitative test. So next one is O'Kane drum and broken wheel test, like Landrot C or that one. If the child's dorsal and ventral is good, but have poor balance in their lifestyle. Okay. I'm not going to tell deeply how we used to assess. Okay, that will take a more classes. Why? Because CVI is like an ocean. If you start studying, it will go deeply, deeply, deeply. I don't think so. Most of them will understand what I said till now. But anyhow, if you have any issues, you can call me and ask. Okay. So this is a framed question done by a research. Okay. So these are all the questions you can ask if the child is suspected with CVI to the parents. Okay. So does your child recognize mother's or father's face before you speak? So does your child reach out and grasp objects? Is your child able to see slow moving objects? Does your child recognizes the faces of other family members? Like the child recognizes familiar objects, fast moving objects. Then you can see the question, can the child recognize the people in photographs or friends faces? So if the child is not if the parent is telling no, it is not, the child is not looking at me itself. Even when breastfeeding my child at the time of 3 months or 4 months, the child is not looking at me and smiling. So initially the child will be smiling by looking at mothers by 0 to 3 months, and the neck holding is delayed like by more than 5 or 6 months. Surely the child is suspected to global developmental delay. Okay, so what will be the early impact and intervention in CVI? Okay, so what can be done if we have done early intervention? So brain adaptation and neuroplasticity. So neuroplasticity is nothing but forms of new neural connections into the brain. So we already have some neural connections into the brain, but in CVI, we can make the baby to understand, and then it will form a new neural connections. Okay, so it will improve visual attention, tracking, and recognition. Okay, like recognition of shapes, colors, as well as faces. Okay, so next is functional vision. So this particular term will help you to understand what is called as functional vision. It maximizes the uses of remaining vision and enhances object and face recognition, and spatial awareness is nothing but the 3D vision, which is called as the depth perception. Okay, so next is multisensory integration, combines sight, sound, touch for better learning. Those who practice vision therapist or they have done fellowship in vision therapy, they understand this particular line: combine sight, sound, touch for better learning. That means you will be teaching the child with a light source, which will be touching and making the child to understand. Okay, so next is strengthens the response to the environment. So daily function and independence encourages exploration and interaction, reduces frustration and builds confidence. So if you see the child suspected with CVA, have you seen their parents? They will be so much frustrated if the child is being formed malformedly in our family. What will be the socio-economic causes? Like how will be my father-in-law or mother-in-law will going to react? Due to that, there will be so many divorce cases as well as, and the thing is, due to that, the child may be left in anywhere, like even in a roadway or a rail track. We have seen so many kids who has suspected CVI has been left alone in the roads or any railway station or public centers where the parent cannot afford the multidisciplinary therapies for the child who are socio-economically down. Okay, so next is long-term development. Okay, this supports cognitive, motor, and social development. So what is this motor thing is nothing but it will be differentiated into fine motor as well as gross motor skills. So fine motor is nothing but if you are writing, if you are uh, using your hands or very much small enough of amount of work. Okay, that is called as fine motor. Gross motor is nothing but overall body movements. Fine motor is particular body movement, gross motor is overall body movement. Okay, so improve school readiness and learning outcomes. So if a child is being diagnosed as CVI, if they are functionally getting improved, the child will be having difficulty in copying from board, as well as the child will later develop into dyslexia or dysgraphia, where the child has a problem with learning and writing as well as. Okay, so what will be the management and treatment plan for the child suspected with CVI? So here we can see in CVI we will be giving multisensory learning, vision therapy, and multidisciplinary therapies. So multisensory learning is nothing but we will be giving vision therapy as well as where the child will be able to identify faces and develop the proper eye contact and If the child is not developed fixing and following light, or the child's vision is less than compared to the normative values in tag or any other visual acuity criteria, so we will help the child to reach that part, but it will be taking in longer process due to the condition of the baby. So here you can see some of the vision therapy, what we will do for a 0 to 3 months baby or 3 to 5 months baby. We will be representing this rotator things, and we are being showing mirror for helping in improving the eye contact, and we are stimulating the baby by different colors according to the child preferred color. We will be giving the stimuli. Okay, so next is OT. So, in occupational therapy, the child will be learning sensory skills, fine motor skills, and cognitive skills. So, if you see, this is called as syntonic light phototherapy. This is one of the best thing to improve the visual fields. In India, there are very few centers which can afford syntonic light phototherapy, where the child is being able to sit in front of the light for 20 minutes, where the brain is getting stimulated with a particular wavelength of light, like parasympathetic and sympathetic nervous system. You can go through this very briefly in internet. Okay, so next is pediatric physiotherapist. So if the child is developed with global developmental delay, so automatically the child will not crawl, the child will not sit at proper time, the child will not stand. So it requires a pediatric physiotherapy, not a general physiotherapy. So where the baby will learn how to sit, how to stand, as well as they will balance their overall body balance. Okay, so next is speech therapy, where the child is learning to get the oromotor skills, and the child will started telling the particular fruit name or vegetable name at initial stages. They will be using the particular clues with the baby, where the baby will learn to tell father, mother's name, appa, amma, like that, like mama, papa. Okay, so CVI, I can tell it's like an home. Okay, where the baby is coming to a therapy, and all the therapy should be framed in a proper like buds. Okay, that's why in our Narayana Netralaya we also have my department like buds to blossom. My mentor Dr. Pooja Sarbajana, where she holds a international degree in CVI, she had developed a department called as Buds to Blossom, where we have all this OT, physiotherapy, pediatric neurologist, pediatric retina, occupational, vision therapy, cognitive therapy, syntonic therapy. So it's like a mother womb. Okay. So CVI kids, we need to treat it like a flower, like they should be handled very delicately. Even if you see a kid with CVI, like they will be having so many behavioral issue, not only in CVI. If you go to the other spectrum disorders like autistic kid or ADHD kids, we should care the child with very much love. Why? Because the way they are seeing the world is completely different than us. Okay, so I am a general optometrist. For example, I am been working in general OPD or optical shop or anywhere. So where will I refer this kid if I feel that the kid is having CVI or developing CVI? So you can refer to a pediatric ophthalmologist or a pediatric neuro-ophthalmologist, where they will confirm the CVI diagnosis or to rule out any other eye related causes like retina problem, lens, optic nerve issues. So they will monitor your baby's eye health and prescribe corrective lenses if needed. Okay. So not all general optometrists can give glasses to CVI kids. Why? Because it is completely objective based, not on subjective based. Here, if we are practicing pediatric dispensing, we know that below 5 years age it will be completely like objective based of refraction, not on subjective. So next is pediatric neurologist, so where they will evaluate the brain injury, perinatal hypoxia, or neurological disorders, any other syndromes associated with these causes, or manage seizures. If the seizure is keep on increasing, the child will lose his or her vision. If the child is having fixing and following, like that too will drop, and the patient will be having no fixing and following, like no eye contact and no menace reflex. Okay, so where they will give some medications where the seizures will be under control. Okay, so who next we can refer is behavioral optometrist, one who holds a degree in fellowship in pediatric as well as in CVI or a vision therapy. They can design the individual with the help of vision stimulation therapy programs, recommend adaptive visual aids, lightning modifications according to the child's condition. Okay. So early intervention team or special educator, you can see there are so many social non-governmental organization where they support CVI. They will be helping the kid with structural, visual, and developmental activities, and train parent and caregivers to continue therapy at home. This is mainly focused on rural areas. Okay. So what will be our conclusion and goal? Okay, CVI affects how the brain understands what we see, not the eyes. Okay. So next is early help can make seeing and learning easier. Simple changes at home or school can improve daily life. Teachers, parents, and therapists or an optometrist working together help the most. So thank you. With support,
Thank you so much.
people with CVI can learn to see the world in their own way. Why? Because their world perspective will be completely different. Okay. So these are the recent research which has been done on cortical visual impairment, where you can see it is associate. Even the Down syndrome will be getting the chances of CVI. And what will be the systemic review on the management of cortical visual impairment. So these and all studies you can go where you can have a good idea about this CVI. And then if anybody willing to participate and to practice CVI, so you want to learn more about CVI in depth and you want to practice how the child is being modified to a normal lifestyle. So you can join us. So we have a fellowship program in pediatric optometry, orthoptics, and neurooptometry, where it will be an 18 months program. You will be getting a hands-on training on CVI, as well as orthoptics, as well as in low vision, as well as in binocular vision. Okay, I
Okay,
think
sir.
I'm
Thank
done.
you. Yes, sir.
Any
Yes, sir. Thank you.
questions?
Before let me come to that.
Hmm.
Thank you so much, sir, for such an amazing and insightful session. The
Yeah,
way
thank you.
you broke down the mechanisms and clinical implications of CVI made the topic extremely easier to grasp, especially because the attendees, most of the people that are here, this is a very fresh concept for them.
Yeah, yes, yes.
Now, yes, exactly. Now we'll move on to the Q&A round. I think a lot of people have already sent questions. I'll
Okay.
read the questions out and then you can reply.
Yeah,
Okay?
yeah.
And it is my humble request to all the attendees, if you all have any doubt, now is the time. You can ask your questions in the chat box and I'll read it out for the sir to answer. Okay, so I think we have our first question here. It is, so what is functional vision assessment?
So functional vision assessment is nothing but where we will identify the child's progress. The thing is whether the child has a dorsal stream effect or ventral stream defect. We don't know, right? So we will be just having a MRI report with us, which is being given by pediatric neurologist or a pediatric ophthalmologist, they have diagnosed. But we, as a behavioral optometrist, we don't know in which part the child is facing the problem. The parent will tell you that my child can pick the ball, but if you do that functional vision assessment test with the help of the tools which I told you, like Leah paddle or a hiding ID or any other mailbox. So these are all instruments which help them to identify how they are using their residual vision. The thing is whether the child can interpret which color. In functional vision assessment, we will do briefly these four tests, like visual fields and eye contact is there or not with the help of hiding ID, and then Lia paddle, whether the patient can see, whether the child can see properly. So the in Lia paddle we use basically the unit value like cycles per centimeter, but in tag, if you are practicing pediatric, you may easier to know. In tag, the values will be recorded at cycles per degree. What we will do is we will convert the cycle per centimeter value to cycles per degree, where how we used to assess the normal child in tag, that we will correlate with Lia paddle. I hope you understand.
Yes, sir. Yes, sir. Now we have another question. Can
Hmm.
you please tell us about some special tests that we carry out in CVI patient for functionality?
Special test in a sense, you need to have that Lia test. Okay, so Lia tools you need to practice, where not all optometrists can practice this. That's why I'm telling it requires a lot of experience. So without experience you will not be able to identify whether the child is having this much vision, or the child is having even dorsal stream effect, whether the child cannot identify these things. Okay, those you can use some Lia tools to identify the functional vision.
Okay, okay. And ultimately, it comes to the fact that clinical exposure is required, if I'm
Yes.
not wrong.
Yes. So, as an optometrist, for a general thing, I would like to tell, if you want to learn more, please do a fellowship or you practice any degree regarding to CVI. So, then you will learn how to interpret those results, because a normal optometrist without clinical exposure dealing with CVI is very difficult.
Exactly, exactly.
Even
We have another.
myself, when I'm doing the assessment or whatever the thing, even I get ideas and clarification doubts from my mentor.
Exactly. I think CVI is a very vast
Yes,
field. So
yes, it's a
you cannot
very
just do it.
big thing.
Exactly, exactly. We have another question. What is the reason behind atypical visual reflexes in cortical visual impairment?
So the thing is, when there is a neurodevelopmental disorder, if the brain is not functioning properly, see, brain is like a CPU. Okay, so if CPU, inside the CPU, the processor and components are there, but the board or anything wires are getting affected, the outcome will not be there, right? So atypical visual reflexes, why it occurs is, if there is a problem in that brain, that inside that where the oculomotor muscles, all those things develop, so if that is getting affected, so the blink reflex is also is getting affected, and the child is not having even light fixation, so they will not have the tendency to appreciate the atypical visual reflex, which is called as menace.
Okay, all right. We have another question with respect to the characteristics of CVI that you've told us about. Which
Yes.
characteristic among the ones that you have mentioned will improve first with proper vision rehabilitation training?
See, with proper rehabilitation training, we should be considering the condition of baby, like which condition, whether the child has fixing following light, or the child has no fixing following light.
Okay, okay. And another question is, how does visual complexity in the environment affect the visual performance of a CVI patient?
So it's a best example if the kid is going to a school, like the parent will might tell you that there is a difficulty in copying from board. Okay, that indicates a visual complexity. Why? Because the teacher might write so many things, like 4 to 5 or 6 words in a sentence or a paragraph in board, like mathematical calculation. The child will be having difficulty, right? And even if you represent 2 or 3 tasks to a kid, the child will not able to do.
All right. And one more we have is, does retinopathy of prematurity have any connection with CVI?
See, as I tell that, uh, we can evaluate the biomarkers in retina. The recent study has been done by our beloved Dr. Anand Vinekar, where sir has been evaluated that particular. He will be looking at the retina where there is a biomarkers in CVI, biomarkers on the retina. If there is there, it is possible to get CVI.
Okay, okay. So it is a possibility.
Yes.
Okay, all right. I don't think there are any more questions. Now,
Comment
I
box, someone is putting.
someone has raised the hand. I think I've already taken the question. That was the ROP
As
question.
movement preference means the child can't see stationary object at all. Okay. So Faizan, I think so. Okay.
Yeah, yeah, yeah.
So the thing is, the child can see stationary object, okay, but the child will not be having fixing following light. Remember the point? The child will not fixing, but the child can able to perceive the motion. Means if someone is moving suddenly in front of you, or the parent might tell you the child is not, you are telling the child is not fixing and following light, but the parent will be telling, when I'm going in front of the child, suddenly sitting and standing, the child is looking at me. Okay, that is the best example you can see in that case.
Okay, sir. I don't think there are any more questions left now. Thank you so much, sir, for answering the questions with such depth and patience. And also, thank you so much to all the attendees for asking such innovative questions. Now, as we come to the end of this session, I'd like to express heartfelt gratitude to Mr. Mohamed Danish for sharing his time and expertise with us today. A
Thank
big
you.
thank you to our hosts, Mr. Mohamed Adnan, founder of Neuroptech, and Mr. Mohamed Asad, co-founder, for continuously creating opportunities for optometry students and professionals to learn and grow. To all participants, thank you for being such an engaging audience. Do not forget to complete your feedback form to receive your e-certificate. The last link that has been provided by Ms. Mohammed Saqib, please fill it out. Now, this is Shazia Shabir signing off on behalf of Neuroptech. Stay curious, stay connected, and keep learning. Have a great day ahead, everyone.
Thank you.